Hi, this is Dr. Y, and I'm back with part 5 of the Trauma and Mental Health series. This video is really about some of the possible long-term effects of trauma and how that can show up in our lives. I also want to share with you some tips on how to talk with your doctor, especially if you have recently gone through a traumatic event. I also think that this would be important for parents to share with their smaller children or their adolescents with appropriate language on how to communicate their needs post-traumatic event so that they don't wind up in a situation where it's triggering and causing additional trauma. Okay, so long-term effects of trauma. Look, trauma can make you more vulnerable to mental health problems as well as physical health problems. So remember, our mental health and our physical health are together. They are one and the same, really. And they push and pull against each other, meaning they impact each other equally. So if we're only looking at mental health and the trauma effects of mental health, we're missing half the picture. If we're only looking at the physicality of what happens to us in a traumatic event, we're missing half the picture. So to have a true effective diagnosis, we have to look at both pieces of a case presentation for a patient. So here are some longer term effects of trauma. Now, when we think about trauma, a lot of people think about some of the side effects and some of the problems that are going to bubble up right after the event. But what I'm here to tell you is that there can be a lifetime or longer term effects of experiencing a trauma. A lot of studies suggest that trauma can make you more vulnerable to chronic and physical illnesses down the road. Having a physical illness after a trauma can make you feel more stressed, more anxious, more exposed. In fact, your entire life has changed now because of the trauma and because now of the consequences of that trauma. So the effects of trauma can last a long time. I've already mentioned that, and it can come and go. Think of it like the waves on a beach, okay? The waves on the sand. It kind of comes in with the tide and then it pulls out with the tide. Grief also works that way, but certainly the symptoms of trauma can work that way too. You may, because of trauma, begin experiencing problems with your day-to-day life. And these may be problems that you never had before the trauma. But now they're showing up and you're thinking, what is wrong with me? Or what is going on with my loved one who really seems to be struggling after this event? So how can this affect your ongoing long-term life after you've experienced a traumatic event? Well, here we go. So number 1 is there can be changes to how you are looking after yourself. Many times after a trauma, we're overwhelmed with the trauma itself. And so we start to let certain things about our own health and our own welfare go. So looking after ourselves may not be the top priority. It should be, but it isn't, and sometimes doesn't wind up as the top priority after we've experienced a traumatic event. Why? Because there's too many other things going on, mentally and physically. And so some of those balls get dropped. So this is a longer term effect that can happen with trauma. Now, what are some of the things that I'm talking about? Maybe it's your healthcare. Maybe it's your physical, the way that you look physically. Maybe it's hygiene. Maybe it's your diet. Maybe it is the way that you speak about yourself. Just overall self-care starts to shift, sometimes in a negative way, after a traumatic event. Number 2, some of the things that can be affected after a traumatic event are a person's ability to hold down a job. Now, this is huge for a family. It's huge for an adult individual because everybody knows we got to hold down a job in order to pay our bills, in order to keep a household flowing. So this can be really, really difficult, especially with post-traumatic stress disorder, because it hampers our ability to provide for ourselves and possibly for the other people in the home. So this can be a long-term effect that you need to look for. So number 3 is really important, okay? And I'm going to link this back to your brain. Number 3 is trusting yourself and trusting others. So a trauma now has challenged the chaos, the danger, and the safety of a person's existence. That's what happened in a trauma, okay? What we thought before was safe is now not safe. So it's no wonder that long-term, some patients have problems trusting themselves and others. It can really show up in our relationships, even with our children, our significant others, our partners, whomever. And it can be very, very problematic. It also can start to task our own self-worth and our ability to trust our own judgment. So seeking help post-trauma is really, really important so that we're not sacrificing the quality of our relationships as well as the quality of our decision-making. The next one is remembering things. So once you have had or experienced a traumatic event, your brain is processing in a different manner post the event. So it can be very difficult for some people in that heightened arousal state to remember things that before they had no problem remembering. So this is a piece of brain function that can be affected by trauma. The next long-term effect may be that you have difficulty making decisions. So a traumatized brain and body may have a real difficult time trusting their own judgment and wading through the heightened and increased anxiety that now comes from having experienced a trauma. It's hard to make decisions when you're anxious about everything. You wind up in indecision because you keep second guessing yourself, right? It's also hard to make decisions when you don't trust yourself. So in video 4 in this series, I talked about self-blame, and a lot of times this can feed in to our decision making. So to be aware that this can be a longer term symptom that we need to work through is really important. So the next one is your sex life. When you go through a traumatic event, there are a lot of changes that can happen, not just emotionally, but physically with your body as a result of that trauma. Now, to engage in a healthy sex life, you have to have both. You have to have a healthy mental view of your sex life and your sex partner, but you also have to have a body that's cooperating with you in order to move forward with that relationship and also to find pleasure in that relationship. So trauma can impact a person's sex life, and I think that's really important in terms of managing the symptoms and being able to communicate that with your partner. Another symptom that can be long-term in experiencing a trauma is really having a difficult time coping with change. The whole point of having or experiencing trauma is that it was a change that is unwelcomed. You didn't plan it, you didn't want it, you still don't want it, and it happened anyway. Okay? So that is going to rub up against any other kind of change in your life. Even if it's planned, even if you've talked about it, even if you knew about it, it's still going to provide some resistance and possibly be a trigger for you, okay? Trigger warning. So dealing and coping with change in the future can be a long-term problem associated with trauma. Finally, I think it's important to understand that you may experience difficulty in trying to just simply enjoy leisure time. You may not be able to do that. And a lot of people get really frustrated with trauma survivors when they're not able to have a good time or relax. You're like, why can't you just relax? Why can't you calm down? That's in the past. It's not something that you're going to have to deal with ever again. We're here. We should be able to provide that support for you. Yeah, if only it were that simple, right? So what I think would be helpful here is to find activities one by one that you can experience by yourself and also with others. Those are two different things. And try to work back relaxation time into your life. And it may look different than before the trauma happened. In fact, it probably will look different than before the trauma happened. But on the other hand, please communicate that with the people in your family and the people in your life. And if you are at a point where you can't enjoy anything leisure or pleasant in your life, it's definitely time to talk to a professional. Okay, now before I shut off this video, I have to share with you how to talk with your doctor. Okay, so this is something that you can teach your kids how to do. And it doesn't necessarily have to be just trauma. It is the exercise of speaking up and advocating for yourself so that you don't put yourself in another situation where you're re-traumatized, right? Okay, this can be really hard to do though, because we don't really know what the words are. And in our society, doctors have generally come from a position of authority. Generally speaking, that's how it's worked. Not necessarily true, but they do hold some powers that the average individual, the patient coming in, doesn't have, right? So understanding that power differential, I think it's important for you to understand how to talk to your doctor and have confidence in this, okay? So here are a couple of tips. Number one, make sure that your doctor is aware that you experienced a trauma. And that means if it was in the past or if it was recent. They need to understand that. They have been trained, a general practitioner even, has been trained on how trauma affects the body. So them just being aware that this has happened to you puts you in a better position of being able to advocate for the things that you need. Okay, number two, help them understand what is helpful to you during the office visits. Now, I wrote down some things that I want you to understand, okay? So here are some ideas. You're going to help them understand that they need to ask permission to do a procedure. They don't just get to do anything willy-nilly with your body. That can be very triggering. So let them know that you've had a traumatic experience. If you want to, give them a general idea of what that is, and then have them ask permission before doing a procedure. Also, it could be you really want to stay clothed during the examination. By the way, you can do that. I know a lot of people don't know that, but you can. When you explain to them, look, I've been through a traumatic event, and this is a little bit about what happened. You don't even have to give details that are deep and triggering, but let them know, and let them know that staying clothed would be more helpful to you and you would feel more comfortable. Okay, also explaining procedures really, really well to you. This one's really important because you're already going to be feeling a sense of distrust, sometimes with yourself or other people, and also just having the ability to make good decisions for yourself. Anxiety can put us in a position where we don't always understand things very well post-trauma. So I want you to understand that it's okay to say, you know what, I need you to explain that procedure again, please. These are now the questions that I have after you have explained it. There is nothing wrong with saying to a physician or to a provider, you know, I think I understand what's going on. Could you take another pass at that? Okay, now the last one is, and this is really important, especially with children and adolescents, okay? It is okay to have and ask for a supporter to stay in the room with you. Yeah, that's right. You do not have to go into that physical office space by yourself. You don't. If this is uncomfortable to you because of the type of trauma that you have survived, then ask and advocate that someone that you trust can stay in that room. That is absolutely a patient right. And then the third thing that I want you to understand with how to talk to your doctor is your general practitioner is not a mental health provider. They have some general training on mental health, but it is not in-depth specialized training for mental health and dealing with the clinical side of post-traumatic stress disorder. So ask them for referrals, if you don't have any, for a behavioral health provider in your area. Ask them for help in linking you with networking and resources that can help you move past this tragedy. Okay, before I leave this video, I want to give to you one really great resource about trauma, and this is for all ages, okay? More information, interviews, and research on trauma can be found at the nationalcouncil.org. So it's www.thenationalcouncil.org. They have a lot of really great information about trauma, especially when talking with children. There's another great website that has a lot of very simplistic information, meaning it's easy to understand for anybody, on mentalhealth.org. Just Google trauma and all of this information comes up. I really like a lot of what I'm seeing on this website, and I think that it would be helpful if you're looking for additional resources. Now that we're at the end of all 5 of these videos on trauma, I hope that it's been helpful to you on some level. I'm going to put in the description area and also at the end of this video more resources for you and for your family. Thank you so much for watching. Don't forget to like and subscribe to my channel.